Sioux Falls discussed the benefit of a bidet, better for cleaning, washing compound, wiping toilet paper, wiping, washing found in European, Asian cultures. Do you understand any of that? A bidet. That's it, a bidet. What about bidet, French bidet, cleansing with a bidet? I'm all for it. I wish we had it here. What do you think?
I suppose if they want to go through the expense of that, I guess, but there's probably a little easier way to maybe just hop in the shower afterwards or something.
Yeah, I like the idea of cleansing, but too much cleansing is the problem too for many people, and they get
certainly for pruritus ani, when you get that itching and irritation on the skin, constantly cleansing and rubbing with soap and water is probably counterproductive, actually.
Yeah. I have found, and this is through Jim. A dermatologist friend of mine who said that we should be using CeraVe, which is a nice cream that holds moisture in. So after cleansing, use a little CeraVe on it, C-E-R-A capital V-E. And Wagner, what is mesenteric sclerosis? Mesoenteritis sclerosis. Mesoenteritis sclerosis. Do you know?
Well, there are patients that get inflammation and scar tissue in the mesentery. It's not very common. Most of the time we don't do anything about it, but it's we see it occasionally. We probably see it more since we've started doing CAT scans, and we see the
right.
fatty tissue more. But I don't know, Scott. It's not a real
Yeah, I've seen it
compound.
once or twice too, and it's exactly as it sort of sounds. You get a scarring and inflammation of the mesentery, which really is, I mean, you see it more on CT scans.
And it doesn't cause major problems. You don't generally do surgery for them.
No.
Well, sometimes you just have to make sure it's not something else that some
kind
other
of weird
type, like a
cancer.
lymphoma or some other type of problem that might require, well, it would require treatment. But most of the time, if that's what it ends up being, and sometimes you biopsy it and you just see the scar tissue, and if that's the case, you don't do much about it.
I was blocking on the dermatologist Jim McGran. I kept wanting to say another last name, but McGran really recommends CeraVe, and I recommend after you wipe gently, you smear all of the CeraVe on there, and then you wipe that away, and it leaves you with a better rear end, and you don't need to have the bidet.